BC Children's Hospital says it is seeing an uptick in visits to their emergency department this month and are asking parents and guardians to check a few things before they decide to take their little one to a hospital. Nearly half of those visits, they report, have been for respiratory illnesses. That's up to 180 patients a day. Officials say while the numbers have dropped since the pandemic years, they're still higher than normal. Joining us now for some perspective and analysis, CBC Health columnist Dr. Melissa Lim. We appreciate your time as always. What are some of those signs for parents and guardians that their child may have more than just a little cold?
Dan, we actually have a Made in Canada tool called SIGNS. In fact, that stands for Severe Illness Getting Noticed Sooner. That was put together about 5 years ago by a group of parents and health professionals. And they say to look for 5 things. So the first one is breathing. If they're having trouble breathing, they're having trouble eating or speaking because they're so short of breath, or also if they're breathing very slowly would be one reason to go to the ER. Behavior is another one. If they are not making eye contact, or they're floppy or limp, or having spasms, or again, not behaving like they normally do, that would be another reason. Another thing to look out for is skin. Blue is obviously a bad color, particularly around their lips or tongue. Looking gray, pale, or mottled, particularly if their skin is clammy or cold, is another reason to seek medical attention right away. Fluids too. So if they haven't been drinking or they haven't urinated for at least 8 hours, or if they've been vomiting hourly for 4 hours or more, another alarm sign. And last but not least, if they're not responding to usual treatment, like if they have a chronic disease like asthma or diabetes, and their symptoms aren't getting better with what you do, or they have any of those signs, go to the ER immediately.
And are there any other steps, so the signs idea, any other steps beyond that before you decide, you know what, this is the time to go?
If you're not quite sure and they don't seem very ill, 811 is always available 24/7. You can speak to a registered nurse at any time. Another thing to remember is if you're lucky enough to have a family doctor or nurse practitioner, try to book an urgent appointment with them, or there's some more minor ailments that a pharmacist can help you with. But something else to remember is after hours, if you have a family doctor, they in fact are required to have a schedule where they or one of their colleagues in their practice are available on call, where you can call them for urgent medical attention after hours. So try calling the phone line of your family doctor and get that information so you can speak with a live person.
What are you seeing in your practice when it comes to respiratory illnesses?
I am definitely seeing a lot more coughs, colds, flus, fevers, earaches. This time of year for sure, it's cold and flu season. But I would say compared to other years, especially right after we came out of the COVID-19 protections, parents have been through the ringer. Their kids have had viruses now, so they're not quite as concerned, I guess. So they have more, they're more battle worn. they've seen their kids through some respiratory seasons.
And when it comes to if they have to choose emergency care or choose to do that, where should they check to which hospital they should go? Is it always the nearest one?
Well, sometimes it's which hospital has the shortest wait time. So there is a website called edwaittimes.ca that you can check. I have spoken with some of my patients, though, who say they check it, looks like it's half an hour. By the time they get there, it's 2 hours. So the best offense against virus season is really multiple layers of defense.
All right. Dr. Melissa Lim, we always appreciate your time and expertise. Thanks for coming in.
Thanks, Dan.